everybody to the statewide Chronic Disease Self-Management Program Collaborative Monthly Meeting, and this is being recorded. I will let you know we did try and record our last meeting, which was late September, which is when we all gathered in person, and unfortunately that recording is a couple of minutes of hold music and then silence for 2 hours. So my apologies, that's why that one is not posted on the website. But hopefully this one will work a little better. So welcome everybody. And did somebody just join us?
Hi, it's Connie.
Hi, good morning.
Morning.
Well, we're just getting started, and we have on the phone with us Julie Knighton, who's here with us from University of Colorado Health North, and Lindsay, and Flora, and Monica, and Cheryl from COA. And have I missed anybody? Okay, great. Well, this is our agenda for today, and we sent out earlier this week, which is basically just to do some updates and a review of everything, and then to go through some of our regular stuff. And then we have a couple of new projects that we want to discuss with everyone. The first thing I wanted to mention was that we sent out a roster for everyone. This is the latest updates I have. And Julie, I believe you sent me an updated phone number. Thank you very much. So I've got that on there. But if there's any other additional changes, updates that we should do on that, please let me know, and we will send that out with the minutes for the meeting. Okay. The other thing I wanted to just review in case people are, Julie, I know this is your first time on the call, but for everybody else too, is that the idea of the collaborative came about because there are so many of us out doing this work across the state, and we wanted to have a way to share best practices, training opportunities, just to make the most of what was happening and to support each other and to be able to share leaders and trainers and all that kind of stuff. So we came up with the collaborative, and then about the same time we were putting the collaborative together, the funding opportunity came up for the AOA ACL grant, which has been very much a part of making this work across the state for the past couple of years, and now we're heading into year 3. But the purpose of the collaborative was really formed separately of even this funding opportunity, with the idea being that we could come up with many different ways to work together, whether there was funding or not funding, or whether to put us in a position to be able to look for funding together. So that's really what the collaborative is about, and we have come up with a memorandum of understanding that we all have signed, and we have joint fidelity to the program, and we are going to talk a little bit today about some other opportunities for work we can do together. But that's just a quick and dirty overview of our Chronic Disease Self-Management Program Collaborative. It's a long name. So first up on the agenda is we wanted to just go through what is happening with, if I can get there it goes. If I can ask for anyone who has any updates, just overview for the collaborative. We're going to talk about training coming up, but if there's anything else anybody wants to add in that regular update section, feel free. We're a small group today. Okay, then I'm going to, yeah.
This is Monica, and we are going to be starting a class in Del Norte, and I will send you the information.
Great.
Are you hearing an echo, Chance?
Yes.
Huh?
I am.
Are you? Okay. Yeah, that's kind of irritating. But and then I did want to let you know, I had talked to you, or we had, as you can see on the website, we were going to go ahead and try to hold a new training, as CDSMP, as well as see if we can get on DSMP 2-day at the end there for, and see if we can get something going in January.
Okay.
I think around the holiday seasons it might be a little rough, and so I'll send you the exact dates, but we're looking at January.
Okay, great.
So, just so that everybody knows that those are coming up.
Good. And we'll, great, that's terrific. Thank you.
Mm-hmm.
And Julie, since, just to give you, if you go to selfmanagementcolorado.org,
Yes.
that's the official collaborative site, and that's where everybody has their classes for the public listed.
Yes.
So, great. Okay. Well, are you all hearing an echo all the time? Is that what you're saying? Or is it just when Monica was talking?
I just heard it when Monica was talking, and I'm hearing it when I'm talking, but I didn't hear it when you were talking, Lindsay.
Okay. Well, and you're using your phone rather than your computer, correct? You've got a phone line going rather than just a mic on your...
Yeah.
You might try turning the mic on your computer off and just talking through the phone.
Oh, okay.
Because that may help too. And the other thing that may help is if you're not speaking, if you mute your phone line, and then when you want to speak, unmute it. Sometimes the background noise will throw it off.
Is it star 6?
Great. I know I'm hearing less background now,
Lindsay?
so. I'm sorry?
Is it star 6?
You know, I don't actually know because I just use a mute button on the phone.
Oh,
I believe
okay.
it is.
I'll try that. I don't have mute on my phone.
Oh, okay. Sorry about that.
It's okay.
I do not know, to tell you the truth.
Okay.
I heard a click. That's a good sign. Okay, so I wanted to turn it over to Connie and Lindsay. We have, somebody made a heavy sigh. I wanted to turn it over to Connie and Lindsay to get an update on our grant our year 2 grant closeout and the beginning of year 3. Do you guys want to take it?
Yeah, I'll jump in. Just to sort of recap where we were last year and where we are now. Last year, now are people? I'm hearing an echo on my voice. Are you all?
No.
Yeah,
Nobody
I hear
else?
the echo on Connie's.
You think it would help if I'll call back in again just to try that? Because I don't have anything different on mine than I usually do. And I can't hear through my computer for whatever reason, even if I were to switch over.
Okay. Well, then I guess if you all want to disconnect, call back in.
Or we can just deal with the echo.
It's pretty distracting to me. I don't know if that'll solve the problem. I don't know if you have any other. I mean, you gave some good suggestions, Lindsay, so I don't know what else to try other than that.
Feel free if you guys want to call back in. We can all disconnect and call back in. It'll be the same phone number and access code.
Okay.
Okay?
Okay, I'll try that. Thank you.
Okay.
Hey, this is other Lindsay, and any echo, so I stay.
You're, okay, I'll stay too. And I think a couple people are disconnecting. I don't know what to say about that. Okay. So you're hearing a little echo on Connie's though, huh?
And I'm not even sure it's Connie's or it's just a background from somebody else when she talks.
Yeah, it could be somebody has it on a speakerphone or something that's creating an echo, and it's kind of hard to know. The only other thing I can do is mute the participants, but then y'all can't talk. So.
Okay, Lindsay, this is Monica. I'm back.
Great. I hope it works better, Monica.
If everybody maybe just mutes themselves until they're ready to talk, because if somebody needs to have their cell phone on speaker, then that's what they need to do. But if it's causing the echo, maybe just if everyone mutes themselves.
I agree. That's usually what it is.
It might solve the problem.
Yeah.
And by the way, Lindsay, can you hear me, Lindsay?
Yeah.
The *6 does work.
Great. Thank you.
Mm-hmm.
Okay, and is Connie back on the line?
I am.
Okay, great. So the suggestion was, especially if you are on a cell phone, if you can mute yourself until you want to talk, that would be great. Sometimes that is what creates a feedback loop. So I'm hoping it is better now. So we shall continue. And I think, Connie, you were going to give us an update on the AOA sale grant.
Yes. So as you all may remember, last year at around this time, we still hadn't heard from Administration on Aging on our funding. I don't remember exactly when we got official notice from them, but it wasn't until after we were already into the second year of the grant, and that meant that we ended up having to let the year one contracts expire before we could restart up for year two, and that required writing an entirely new contract, which is a lengthy process, and then we needed to put that through clearance, which with contracts which are 20 to 30 some pages plus attachments. That's a lengthy review process. So this past year, I've mentioned this before, but we changed the language in the contracts with AHEC and COA so that it would be very straightforward to identify, to allow us to extend it in year three. The verbiage we use for that process is to write an option letter, and that basically allows us to exercise the option to extend a contract with the same terms that we put into year two, but just add more or less. Like for AHEC, more or fewer completers, and with COA, more or fewer medical practices they're going to work with, more or fewer trainings, etc. So the intent of all that was to make it a quick process for the option letters to get in place this year. And I'm sorry to tell you that that hasn't happened. We got those into clearance as quickly as possible. Lindsay Blackwelder did what she needed to do with working with all the license holders to identify how many completers that that they all believed that they could meet in year two, and she did a good job of identifying how many were realistic from that list of requests. But there's some additional review of all contracts within the Department of Human Services, and our option letter, I think, is just caught up in part in that process. There's additional review and additional layers or sections that are involved in reviewing those. So some people had, I think the latest that anybody said they could start classes in the fall was around mid-October, and I know you need time to recruit people before that. I hate to predict, because my predictions in the past have been wrong as to when that will be approved. So all I can do is, as soon as it is, let Lindsay Blackwelder know, and then she can work with you all on whether you can get anything going this fall that would be funded by the grant. And that's the upshot of all that. I did not think I would be telling you that at this point, and I know it impacts lots of organizations, and bottom line, lots of people who could be taking classes this fall. And, you know, I can't control that.
No, you can't. Well, Connie, thank you. I know you tried very hard to get this through the system as quickly as you could, and in a place that a lot of changes were made to be able to make it work faster. So I know you did everything that was within your control, and I just want everybody to know that. I know you pushed the envelope, but there's a limit to how much then you can do outside of that. So it's a bummer, but thank you for trying to get it expedited.
Well, I learned a lesson on predicting how long it will take, which is, the answer is I don't know. We did do everything possible. I mean, if we had heard from it, a lot of things, it just takes longer sometimes than others, and I'm surprised and disappointed about that, as are all of you, I'm sure.
Yeah. Well, but those of us who have, as you know, we've been doing this a couple of years now, so I think that even though it's not great news, we were all kind of, we understood that it was a hope as opposed to a promise that it would be done sooner. So hopefully that doesn't throw people off too much. So, because you've been very honest about it isn't done till it's done. So, so can you give us I know that we have good things coming up in year 3, and that initially year 3 was going to be a little quieter than year 1 and 2, and we have some good things coming this year. Can you give us a final breakdown? Maybe Lindsay can do this, of how many completers we had, because I think that's a really impressive number.
Yeah, Lindsay can do that.
Yeah, I can do that. So I'm very pleased to report that in year 2, the funding cycle we just completed, we had 373 completers, which is,
Yay.
I was very thrilled with. Yes, so we met, excuse me, our original, and which was the 300, and then we had received that carryover funding for an additional 130, so that our total we were looking for was 430. So we did not quite meet that. We got to 373. I was very, very pleased, and we don't necessarily break out the numbers for the original year 2 funding and then the carryover funding, so they're kind of just all in one pot. But I did track them separately because originally I thought we did break them out. So I'm very happy to say that we did meet all the carryover funding. So those people that said, hey, I met my original numbers, I can do more, because of all your efforts, we did spend down that carryover funding, which was 130. So where we didn't quite get there was that original 300, and that's just because some people didn't complete any series for a wide range of reasons. And then, of course, we know that we didn't do any reimbursement until January. So that entire fall, we didn't have any numbers from then. So that's why Connie and I were so hopeful that we could get things in place by the beginning of October, by right now, so we could count your fall numbers, because we know that you do have a lot of completers in the fall. So we'll just keep pushing through, and right now we have, for year 3, 270 completers, and then I'm sure Connie will speak in a moment about the potential carryover funding. And I did get those 270 completers allotted as fairly as possible to all the license holders who chose to participate in year 3. I have not shared those numbers yet. I do have your MOUs ready to go out the email door as soon as I get word from Connie. I haven't let you know what your numbers are. Just I was hoping that we would be able to get those MOUs out quickly. So they are ready. I just have to put an accurate date on them as we get those. If you really need to know what your numbers are, of course, send me an email and I'll let you know what your numbers are, your approved numbers are for year 3. But again, thank you for everything in year 2. I thought it went much more smoothly than year 1. And my hope is that year 3 will reach our numbers very quickly, very easily, and spend all of our carryover as well. So does anyone have questions for me before Connie has maybe an update on the potential for carryover funding for year 3?
I have one quick question, Lindsay. So, or maybe just a reminder. In terms of those dollars that you are going to be working with, just so people know, it is not. You can't expect reimbursement until you have something that has a signed by the state date on it, and that's the date you need to work with. So even if we get word tomorrow that things are in the works, the start of your funding is when you get the signed letter that's co-signed by the state, and that's the date you need to go with.
Correct, and we'll make sure that date is really clear when I email out the MOUs, that any series that started before this date are not eligible for reimbursement, but any series that literally start on this date or after, good to go. So we've tried to get everything in place so that as soon as that word comes out, I can send you that MOU the same day, and we can start on that day. So it's just waiting for that notification at this point.
Wonderful, thank you.
This is Monica, and I have a question. On the year 3 carryover monies, now that can't be spent out either until the contracts are signed. Is that correct?
Correct.
That's
so
correct.
Has not even, she's not even, I'm assuming, has not even submitted yet for that carryover funding, because we at AHEC have not yet submitted our final invoice. We just got the template to submit that this week. So I'm sure she'll get started on that. And that seemed to go faster last year than the actual contract signing. But once we find out what our carryover funding is, I'll then pass it back to you all and say, here's our carryover. Let's just say it's 100 to be easy. And then you all, just like you did last year, can submit and say, you know, you only gave me 20. I think we really could get that additional 20 we said we could. Can I have 20 for carryover funding? And then I would do a revised MOU with you. And the point is, we want to get that revised MOU in place before you meet your original numbers. And COA had this issue last year, as did a couple other people. If there's a gap when we get that signed and you have a series slip in that gap, we can't count it. So as soon as I find out about that carryover funding, I'll get that out to you guys as soon as possible so we can get revised MOUs signed so that there is no gap, so that when you do finish and you meet your original year 3 funding, then you have that revised MOU in place and you can start spending down that carryover funding that you signed for. Does that make sense?
Yes, it does. Thank you.
Okay, you're welcome.
And just to add to what Lindsay just said, she's correct that I have not submitted the request for carryover funding yet, because we do have to close out the books on year 2 to know exactly how much money was not spent, and then to develop a budget to submit to the Administration on Aging to request permission to spend that money and to submit it in the way that we are requesting. Lindsay's also correct that the carryover funding was approved more quickly last year than the contract, for the reason I mentioned earlier, that was part of an option letter, basically, again, extending the existing contract that was already in place to do more of what already was specified in AHEC's contract. So that process worked last year, the option letter for the carryover, like it should, which is that it was written more quickly and was approved more quickly than a brand new contract. So that's why that went through more quickly than the revised contract that we did back in September, October, whatever. So once we close the books on this year, then I'll start working on that budget and submit that. And it also happens at the federal level where it's not just a state issue, but where I'll be told by one person that they've, it's gone through their hands, so they're assuming that the next level review will be quick, and it's not. So I, again, will not predict that. Just it does take time, and we will do our part to do what we can to make it as quick a process as possible. I did talk to our SUA director, Todd Coffey, about the impact of this, what's going on right now. and he provided some feedback to some other folks. So maybe that will help with that next option letter for the carryover, but time will tell.
Well, thank you. And we know it's in the works. That's the important thing. So, so thank you.
It will,
yeah. Just, we don't have any new data for you on our monthly centralized referral system updates in terms of we have not had a lot of referrals that have come through that system. What we're finding is that people are working, as we've said before, with their partners, their local partners, which is great. It just means we haven't had a lot of uptake on that centralized referral system yet. So I don't have anything new to report on that one. Flora, do you have anything you want to say about data or data?
Let's see here. I had a check-in meeting with Lori, and she said that it's going pretty well. Data's trickling in, and it's mostly fine, and she's not seeing many issues. She did say that I could remind people to go ahead and encrypt anything they decide to send over email, but she is getting most of the workshop packets and other forms through mail, regular post mail. So that's about it with the data. Excuse me. But then I just wanted to also let you all know that my position got reconfigured. So I won't be doing, I'm still here at the department, but I won't be doing this CDSMP work anymore. And so I believe beginning next month, Kelly McCracken will jump back in and be participating on the call more.
Well, bummer, Flora, we just got to meet you in person. See,
I know,
there's some curse. As soon as we meet in person, people leave. I don't think that's right.
No, I think that was a good thing. That was a very good thing. It was nice to finally meet you all in person. So,
yeah.
If I'm not at the next meeting, Kelly will be here. Otherwise, it'll be the meeting after that. We just haven't figured that out yet. We're going through the transition plan.
What is it you're going to be doing?
I'll still have my other half of my work with the Wiseman program, and then adding on more of the breast and cervical cancer prevention work. So.
Wow. Well, I hope this is a good connection with
disease. Yeah.
Yeah.
Thank you, Lindsay.
You're welcome.
In the meantime, I'll still be on this for the next month or so. So if you all have any questions, data related or anything, please don't hesitate to email or call.
Okay, anybody have any questions for Flora?
Well, I don't have a question, but I'm sorry to hear that, Flora. You've been very nice to work with and very responsive, and you really seem taken your responsibilities with this program seriously, and I'm sorry to hear that that you're moving on. Certainly, we'll be happy to have Kelly working again if she ends up staying in. Holding on to that responsibility long term, that would be great too. Yeah. But thank you for all you've done and for jumping in, and I wish you the best of luck with the other parts of your reconfigure job.
Thank you. Thanks, Connie.
Well, I wanted to talk just a little bit about what we did last month. Our last monthly meeting, as you know, was our in-person meeting that actually happened the end of August instead of early September. So, but it was our September meeting, just to confuse us all. But it worked really well, and it was fun to have everybody in the room, or a lot of people in the room. And we also had the folks from Maryland Nonprofit with us to talk about really sort of the future of how we can sustain the program. And so, Connie, do you want to give a little bit of an update on where we are with that process and with Maryland Nonprofit?
Sure. I got feedback from several people that they thought the meeting was really helpful, and I hope that that was the case for everybody involved. I think all of you were on that, except for Julie, involved in that meeting, and I was happy with it. I think it gave everybody an opportunity, everybody who was there, an opportunity to provide input, to talk about some of the issues you're facing, and I really appreciate the participation and attendance by all of those who came. Right now, and over the past couple weeks, I've been working with to develop a written follow-up survey that was sent out to everybody a couple times. One, and that was for, and still is for everybody on the collaborative network, including the people who attended the meeting. So that what we're hoping is to get a written responses from people and sort of a tally on some of those responses. So far, there 11 people have responded, and I was just looking at the roster, and it looks like we have around 17 regular participants, so I'm hoping we'll get a few more today. But I sent out a reminder, and just a question for those of you who are on the call. Some or all of you may have already responded, but did you get an email from me yesterday or the day before reminding you about the survey?
Connie, this is Monica, and I did, and I will get that into you today.
Oh, great.
And I'm going to have to break away for just a couple minutes, but I'll come back on. Okay?
Okay.
Thank
Great.
you.
Is anybody on the call who did not get that email, the reminder about the survey?
Connie, can you hear me?
Yes.
Okay, this is Eve with Secahec, just letting you know I did get it and I did respond.
Great. Okay, I just wanted to make sure it wasn't bouncing back or not going through for some reason, so that we'd be expecting something that people hadn't heard about, so thank you for letting me know it has. The other thing we're working on is they've started the phone interviews, and we have limited time in the contract to do everything that we'd like to do with them, but I like to have them do. But they're starting, so we're identifying people, prioritizing people who could potentially impact or have some high-level knowledge or guidance about how to impact financial support for the program long-term. So we definitely won't be able to interview everybody who we'd like. But we started that. They have started that process, and I'm working with them to identify appropriate questions, and so that hopefully we can get the kind of information that we need. So I think they're very responsive to email. Wendy Wolf is the main person, the lead working on this, and they're both very enthusiastic about CDSMP, and Wendy's very responsive and is taking this to heart and moving quickly on everything. So everything's moving along. If anybody has any questions.
No?
Connie, maybe you could, I think everybody on the call has been pretty involved, and I'm wondering if there's something we all can do to help get the others involved or more responsive. Do you have any ideas?
Well, yeah, the only thing I can think of is if there's more than one person in your organization or agency, to just kind of give them a nudge and see if they haven't responded, to ask them to do so. Other than that, I don't know, and they don't know who has responded because it's anonymous, so I can't reach out to 5 more specific people, which is why I sent it to everybody. And so I can't tell you who hasn't responded for anybody to encourage that. But I don't know. I sent an email. You forwarded an email, Lindsay. That's the only thing I can think of, is to just try to get other people in your organization to respond if they haven't already.
Well, and maybe we can all say, if we're talking to other partners, just say, have you had a chance to respond to that survey? And if not, now's a good time.
Yeah, well, today is a good time because today's the last deadline. So we extended it through today.
Okay.
This is Eve with Secahec, and just letting you know, Crystal was pretty good about prompting us. She did take the responsibility to say, hey guys, we got to do this. So,
great.
Yeah, and so I just wanted you to know that, yes, she did do that. She's not here on the call. She's actually on the road today. We're doing so many things. Sometimes we're not sure where we're at, but she's off today. Anyway, so she's pretty good at prompting us. So thank you for that reminder.
Okay. That's great.
Hi,
Thank you.
Welcome to the call. Glad you guys made it.
Yeah, so we're kind of rushing around here, and I thought, oh my God, everybody is off today except for me and Doreen. So I thought I need to get in on this call, so I apologize for coming in late.
No, we're just glad to have you. Well, is there anything else you wanted to say about the work with Maryland nonprofit, Connie?
No, that's pretty much it at this point.
Okay, great. I think we're gonna get a lot out of it, and that's what's I think important. Is it makes us all sit down and think jointly, which is really cool.
Mm-hmm.
So speaking of joint thinking, one of the things that we had discussed was that in our first year as a collaborative, we came up with our joint memorandum of understanding. We had a work group that put together the fidelity plan and how we wanted to do that process and procedure, and we came up with a training. And what's happened lately is I've had quite a few emails and requests and some phone calls about how we do recertification. And it came up when we were all together in September, or August for September, which is the way it works with Stanford is that if you have leaders that have not had an opportunity to train, they get to a certain point where they are no longer legal to train. They're no longer certified, and it used to be that you had to then have them go through the training again. And Stanford several years ago sort of changed how they were doing that, left it up to the license holders to be able to come up with a plan for re-engaging and starting the clock again on some of those leaders. And so what they asked for was a written policy and a copy of what you were going to be doing to recertify or re-engage leaders that were at risk of losing their certification. So this was designed not for people who had not taught a class in 2 or 3 or 4 years. It was designed for people who maybe had trained as a leader, had tried to get classes going, couldn't, were now in the 11th month since their training and needed to have a chance to extend that period. So anyway, we from COA have put together our recertification. We called it Re-Engage and Recertify, and we have done this in English and in Spanish. And there's a work group now that is multi-state. It's people from California, Oregon, Arizona, New Mexico, and Colorado who have been working on a sort of a joint effort at recertification so that we're all using a similar plan and a similar curriculum. And then Kate Lorig has been on the calls, as has Sonia Alvarez from Stanford at times, just to talk about what that would look like, how it would look. Hopefully long-term they want to do it as a webinar so that it's available and can be used by any license holders across the country. That's very much the long-term plan. The short-term plan is to just take a look at what's happening, and a lot of what they're basing it on is what's already been done in Colorado and New Mexico. So we're kind of ahead of it on this, and we know we have something that Stanford's already said is fine with them. So what we're wondering is how you all would feel about putting together a work group to come up with a statewide CDSMP collaborative re-engagement, recertification policy and training that then all the license holders in the state could use as members of the collaborative, so that we all had similar processes, procedures, rules in place, and a set curriculum for what we do to restart the clock on some of these leaders. Would that be something that you all would be interested in? And if so, would you be interested in being on a work group to do it?
This is Eve. I think it's a wonderful idea. And I always say when you're not here at the meetings, that's when you get volunteered. So I'm thinking I might ask Crystal to be part of that work group.
Okay, great.
So I can talk to her about it, but I think I'd like to consider that for Secahek. I think it's a wonderful idea just because nationwide and statewide we're trying to standardize things, and I think when you have similar or same rules and policies, etc., it just simplifies things for everybody. It just minimizes issues that might come up. So
well, thank you, Eve.
I think it's a wonderful idea.
Good, thank you. Well, Holly Darby, who can't be on the call today, not Holly Darby, Holly from Weld County, Holly, definitely said she would be more than happy to be on the work group. So we'll add her. She was great help on the Fidelity core work that we did. And I think, you know, my thought was that especially for the smaller license holders, that to come up with these kind of processes, procedures, and to have the bandwidth to do retrainings and things is really hard. So if we can help with that, that's a good collaborative effort. So
let me just say that, of course, like with everything, as the healthcare programs manager, I'd like to clear that with our executive director, but I think it's a great idea. There's a huge need for what's taking place with self-management programs.
Okay, great. Well, how we did the work group around Fidelity was that we kind of gathered, we gathered once in person, but we gathered by phone a couple of times and just looked at materials that were already around and then edited, expanded, reorganized, talked through, and then sent it out to everybody for their feedback. So it was not a huge amount of time, but it was very deliberate concentration and intention on what we wanted to, the product we wanted to have available. So I'll tentatively add you all to the work group. How's that? With the caveat that, of course, you'll want to run it through your ED to make sure it's a good thing.
Thank you.
Is anybody else interested?
This is Connie. I'm not sure I would be the right person to be involved since I'm not as familiar with all the training. But I just had a question, Lindsay. You may not know this yet, but do you have any idea about cost and whether that would be provided by POA, or is that kind of in the future to decide those kinds of things?
Well, when we did the Fidelity work, we didn't actually have any cost involved in the time to put it all together. And so I don't think there'd be any cost involved with that piece. The actual delivery, part of what has to happen is it has to be a master trainer needs to be involved, and there needs to be a practice teach. That's part of what Stanford has asked for. And so we would need to have a curriculum available, and then we would have to have the ability to deliver it. Now, individual license holders can either use one of their own master trainers or can contract with a master trainer or see if they can get a master trainer to donate their time. So we have a kind of just from what we've already done at COA, I kind of have an idea what it would cost for a day of a master trainer's time. but every program could kind of do it however they wanted to. What we've usually done is have it be free for the participants that need to get recertified, but we make sure that we don't do it unless they already have classes lined up, and we kind of cover the cost that way, and then we have then charged people something very nominal. I want to say it was like $50 to attend if they were, from other license holders. So, I think we're not talking about a lot of cost, and I think there's a number of different ways we can spread it out so that it won't be expensive for individual programs to use it.
Okay. Just a thought, other people can chime in on this, but one of the things that was suggested at that in-person meeting that we had with the consultants is a couple people were talking about ways to collaborate with other license holders on things in general. This might be one where I know there's some people who are trained as master trainers and like doing that kind of thing, and maybe they could offer, maybe it would be a consideration to offer that for other regions as needed, or other license holders. So.
Absolutely. The thought was that we would have this in the minutes, and then we'll send out an invite to have people involved. Because I know we had talked with the Center for African American Health about the possibility as well at the meeting, the in-person meeting, and I think they were interested, although they haven't been able to join the call today. So definitely we will include as many as we can or as are interested.
Yeah.
And then, before it becomes official, what we'll do is it'll be a draft, and as we did with the Fidelity Corps work, we'll send it out to everybody so they can have input and edits and feedback and all those kind of things. So it won't just happen overnight.
Just in case what my comments were confusing, I was sort of jumping ahead to the actual recertification process. So in case that wasn't clear, like, if a master trainer needs to do that, maybe one of our existing master trainers who's, in the program, so to speak, is employed with one of the license holders. Maybe there's some of those folks who'd be willing to do that. That's what I meant, in case that wasn't clear.
Yeah, okay. No, I missed that part. But I think,
okay,
yes, and I think a lot of the master trainers are more than happy to do things like that. In fact, we've done things like that. Some of the COA trainers have. So I'm sure that we will be able to find ways to make this happen across the state. So, and just to have it, and it may be something that not every license holder will ever use, but for those of us, it's nice to be able to have the option, because you sure hate to train people and then lose them. And so especially if you're losing them just because you've had to reschedule classes and they've timed out. So this is a good option.
Hi, this is Glenda Mitchell at the Center for African American Health.
Hey, hi, Glenda.
Call, but I'm sitting on a cell phone. That's why I was just listening in. I just didn't feel that I could contribute too much with the recertification process, because I have yet to be trained myself in CDSMP or DSMP. So I just don't want to muddy up the waters for the work.
Okay.
But we're certainly interested in seeing that move ahead. I guess my input is I don't know how long it will take for the national effort or that group that you mentioned that's working on the same kind of initiative. And unless they really want someone like us to hand them off everything here, it's ready to go, because I think that's probably what they did with your Fidelity package. But it's just my suggestion. I don't know if it'd be a double effort or that just by the time you get your work done, it's already coming out the door, and then it would be a process change. So that's that's a very good observation. And here's what I can tell you is
what they're looking at as the, it's really expanded to this whole webinar thing, and who's going to do it and who would own it and who would film it and what the budget is. And so it's become very much a long-term project, and it has, the meetings have been going on for about a year, and Joni Saunders from COA's office is the one who's been sitting on those calls, but what they're using is their basic outline, talking points for what the curriculum would look like is what was developed at COA, and then they're adding and trying to figure out a way to do it virtually and that kind of stuff. But it is, they are not, they're still talking about it, but they have not gotten, there's no set timeline, there's no budget yet. So I think there's still, we still have several years probably of needing to do something internally for ourselves before there's anything official coming out of Stanford. And when it does come out, it looks like it's going to be very similar. So it won't be that, we're switching totally from apples to oranges. So
that sounds great. I think you should move ahead with all of the
okay.
Thank you.
Great. Well, then we'll definitely then include you in terms of feedback and input. Okay. Thanks, Linda.
Thank you.
Lindsay, I have a question. When you were talking about filming, I believe, did you want something that was on, like a video type of visual presentation, not just a webinar with information, with text on a screen?
You mean for the training itself?
Yes.
Is that what?
I thought that's what you were just saying about wanting to have it filmed. Maybe I misunderstood.
Well, that's what Stanford is. Stanford is looking at videotaping it and trying to figure out a way to make it something like they do their cross-training for master trainers, which includes some interactive pieces as well as some taped pieces. So that's what Stanford's working on. What we're doing, at least what we have been doing, and this will be part of what the work group would want to look at, is we require a practice teach just to make sure everybody's, which means you pretty much have to be live in the room with somebody. So what we would be doing would be coming up with a curriculum that would be available to master trainers to then work with the license holders and get the classes set as needed. So it wouldn't be a set webinar piece.
Okay.
Okay, great. Well, then we will send out some invites and updates, and we'll kind of take it from there. And again, it's not like we're going to do this in a vacuum. We'll bring it back to everybody, and we'll make a presentation at the meetings, and we'll make sure everybody has a chance to provide some feedback to it. So, so thanks for that. Want to just move ahead, updates on trainings. We heard from Monica. They are going to now look at January. And we are on hold with the chronic pain program. We're waiting on Stanford. They are updating the curriculum, and they are updating our license. And so we are on hold. But we're hoping to do that as soon as we can, first of the year. And then I know SECAHAC has a training going on next week, is it?
Yes, that's correct. We do.
Okay.
We have diabetes training, actually.
Is that just a 2-day or a 4-day?
We're actually going to do a 2-day.
Okay, great.
I think that's
so that's for people who are already chronic disease leaders that can cross-train in diabetes.
Yes.
Okay, great. And I know from what Crystal said, you still have some room in there, so there's the phone number. If anybody knows anyone. Okay, and then Connie, I know you wanted to talk about some marketing issues. So I will, I don't have any other agenda items, or I don't know if anyone else does, but I know we wanted to give you some time to talk about some marketing things. So I'm going to turn it over to you.
Okay, thank you. Just dawned on me, too, that I had mentioned to you and asked Monica if, and this is related to marketing, but I've been really impressed with Monica's success at getting completers in such a large geographic area with a large number of folks, and I wondered if thought it might be informative to hear how she's done that. So, Monica, would you mind taking a couple minutes to do that, or are you back on the line?
I am. Well, I think one of the biggest reasons that we've been doing pretty good is the fact that we have continual classes. I know a lot of folks, they do them maybe twice a year, 3 times a year, 4 times a year, whatever, and we try to run them as much as we can. At the end of 6 weeks, we advertise for another class, and we kind of are continual like that, so that really helps. And again, we have the issue, which, of being very rural, and so, our leaders that we have, what we've tried to do is when we do a training, we're trying to get leaders in each area of the San Luis Valley so that they're specific to that area, and that kind of has helped also. And then we're not doing as much traveling as we used to do. Also, and I know this is like with everybody also, but, with our collaboration with the hospital here, they run a disparities grant, or they have one to offer, but their grants, this particular one is through the PDSD, the tobacco program, and that's how they're funded in the disparities grant as far as helping us. And so what I would think would possibly, if you are looking for other organizations to collaborate with or partner with, maybe possibly talk with their diabetes administrator or whatever they have at their hospital, and ask them about what kind of grants they have available. I know that they've been using this tobacco program or this tobacco grant for the last 2 or 3 years for us, and you can even bring that up and see how that would work with, maybe offering or working with you guys offering, being able to offer a grant, that type of thing. And Lindsay McIntosh especially, we have finally broke through with Statewide, which has been awesome.
Yay!
And
yay! Congratulations.
Yes, we're not getting the referrals like we want to yet, but we're not giving up. But at least they are putting our flyers and that type of thing in the exam rooms at all of their clinics.
Oh,
and
that's a good start.
That's an awesome start. Yeah.
Yeah.
And it's a lot of work, but hopefully nobody kind of gives up or that type of thing. And I just think that for us, with having concurring classes and just running them consistently has kind of helped our numbers a lot. So,
great. Hey, on that disparities, on your disparities or the money you get from the hospital, through the disparities grant, you mentioned talking to the diabetes administrator. Does that mean that the funding that they use to support what you're doing is just for diabetes classes?
You know what? It's actually, it's like a community health worker program. And so what they have done is they have, it's really kind of different, but on their end, they look at us or at me anyway, as a community health worker. But as a community health worker on their side, what I do is bring classes, to their patients and in the community for them, so they look at me more as a community health worker. And and so, that's another way maybe to talk to their diabetes program administrator, whoever, is go in and ask them if they work with or have anything for community health workers, because I'm sure they do. That's kind of how they get reimbursed, and that's something that they have to do. So, if you talk to anybody, talk about the community health workers and see if, bring up the tobacco grants, or if they have any specific grants that a community health worker could work through. And, they might have some other ideas or other ways that they get their monies, but I know that the money's out there.
So Monica, just to clarify, they provide some funding for your position as a community health worker, and then you provide classes for their patients? Is that what I was understanding?
Yeah, well, we provide classes, of course, to the community, which then they look at that as, okay, the community, their patients are being part of the community.
Okay.
And so, that's how they're kind of working things together. And what they do is they reimburse us. We get, they'll let us know what we get, a certain amount of money that we get. And then that's usually not distributed, or it hasn't been the last 2 years. They work on a 3-year cycle also. And so usually at the end of the year is when we get reimbursed. But I think this year, when we signed the MOU with them, they're going to, we're going to invoice them like quarterly, which is a lot easier than at the end of the year. The only thing that I've noticed with them, and so this is something that you have to look at within your organization, whether you can do this or not, is because they have certain numbers that they have to provide, of course, for their grant writers, or for the state looking in, for their grants. For example, they want us to sit. I can't tell them, well, let's see, I'm looking at completing, maybe having 50 completers this year, or 65 completers this year. They have certain numbers that they have to go by, and so we really need to sit back and say, well, can we meet their numbers? So, like, for example, this year, they put us down as completing 120 participants, having 120 completers. And, like we told them, that's hard for us because we're, unless we can get new leaders on board and that type of thing, it's really tough for us to get 120. That's a lot. That's a lot of completers. But it's a goal that we can all set. And, it's like, okay, if we have the leaders there and we run them continually, you have to work with different times, days, evenings, that type of thing, different programs out there that, public health and different public systems that we have around here to get those completers. But, it can be worth it, depending on the money that's out there and the help that you have. So that's the deal, is they have a certain number that they have to work towards also. So that kind of sometimes puts a little pressure on you.
Yeah, it's a lot of pressure.
It is a lot of pressure. It's kind of like, okay, how, so I guess you kind of have to weigh it out and say, is it worth the partnership or not? But, if you can get them to refer, which we've been partnered with SLV Health, and to be honest with you, they haven't come up with the numbers that they said they were going to come up with either as far as referrals. We're still working on it. We're not going to give up on it. So we are really depending on still the advertising and the community coming in to get those numbers.
So do you not have input on the front end to say this is how many we can do?
We do. I mean, because we meet at the beginning of every fiscal year, and we do go over the numbers and whatnot. But, you know, what I've done is I've said, okay, well, realistically, this is where I think I could be, or that we could be. But then they'll say, well, you know, they've come back and said, well, you know, those numbers for us are too low. If those that are writing our grants or the state's looking at our grants, whether they're federally or state funded, you know, they're not going to be happy with those numbers. So the only thing, what I do is I just say, well, you know, then we'll have to kind of go, you know, right in between or have a happy medium or something. And then I can either meet those numbers or I can't.
Yeah.
And they're in the MOU with a certain number, and they already know from the conversation that we had that, you know, I will definitely work my hardest to get to those numbers, but I'm not guaranteeing that I will meet those numbers. And I just tell them up front,
yeah.
you know, our goal will be there, but I can't guarantee that those numbers will be met. And that's all we can do.
Yeah. So it sounds like the hospital is looking at this as, correct me if I'm wrong, as something that might prevent additional hospitalizations. If somebody in the community has taken this class, then they may not end up needing the emergency room or hospitalization. Is that?
Exactly.
Yeah.
Exactly. Yeah.
So anyway, I thought that was really interesting, and I know Monica referred to it in our in-person meeting, so I thought it might be helpful for others to hear about that, more about that, in case you wanted to pursue something similar in your areas.
Yeah.
So thank you.
You know, it does help in, you know, because when we can't get reimbursement, let's say now the contract's not signed, we still have another class, and we're wanting to get one more class in before the holidays actually set in. So we pretty much know that, okay, these two classes that we do might not be reimbursed for through the state, you know, through you guys. And so this disparities money that we have coming through, that sometimes, depending on when we get those funds, that will help us to put those classes out there, you know, and be able to fund the expenses, and so that's kind of a backup. That's how we look at it. So
that's a great way to leverage your funding.
Yeah, yeah. So
that's a great way to make the most of it, and to really then provide consistent service to the community, which is what we're for is, okay, we want reach and we need, so I think you've really hit it a couple of different ways, Monica. Not only have you been patient with people as they're getting the whole referral thing going, but that consistency and being willing to sort of, okay, if we can't fund it this way, let's fund it this way. Because you can imagine how hard it would be to start and then stop and then start and then stop. You know, so to be able to really have a schedule and know you can keep going is
yeah. And I think
really
that sometimes you're tested because, you know, people say, well, okay, they're bringing this program in, but how long is it going to stay? Is it, you know, are they going to get it going for, like you said, like a month or two, and then they're going to kind of drop it, or, you know, and I think that's kind of what the docs are looking at. Is it a program that's coming in and it's going to be able to be funded, or are they going to get their patients in there and kind of become, it's a routine where they refer their patients into it, but then all of a sudden the program's not there.
Yeah.
And so we have to prove, especially to the doctors, that, yeah, we are here. We're here for a long term, and this is what we have to offer.
Well, and I think for Valley View, you also had to prove that you were hearing what they were saying, and that you wanted to work with them, and that you weren't trying to make it hard. You weren't trying to give them more to do. You were trying to be a resource for them, and I think they finally heard that, which is terrific.
Yes. Yeah.
That's been a long road.
It has been, but it's so well worth it, though.
That's great. Thank you, Monica. Well, what I wanted to just sort of start a conversation about, and we don't have a lot of license holders on the call today, but from my perspective on trying to market the program, excuse me, on a state level basis is a challenge for me, and an obstacle has been, what do I call this? We have the more the more standard name, chronic disease self-management program, but and for people in the field, for healthcare people, they use those terms, they're familiar with it, and so it makes sense. But when you're trying to market it to the broader community, it just has a negative connotation. If you think back about the first time you heard this, and you might have had that reaction, and a lot of people, I think, do that. Even if we have a chronic disease, we don't want to think of ourselves in that way. And then, so we have some other more positive names, but there are a variety of them. And I wondered actually what all they are. And I looked on the website that COA has done. And it looks like, Lindsay, that you've taken off all those specific names, like, whatever people are using. I don't know if that was intentional or not, but I think that's probably
if
helpful.
You look at it, depends on, Connie, how it works is that all of them are listed. If you're just looking at the group of classes, then all of them are just listed. And then if you go to the details of each particular class, it will tell you what that class is called. So it'll be Healthy Living, Healthier Living Colorado, Be Well, et cetera, et cetera. So, so it does reference all of them, but it references when you're looking at the detail.
Okay. So the ones that I know of, and tell me what else I might be missing, is Be Well, what you were just saying. Is it Healthy or Healthier Living?
There's two. There's Healthier Living Colorado, which is the COA one. There's Healthy Living. I do believe there is one that is Healthier Living. Healthier Living with Chronic Conditions we've seen used.
Is there a Living Well?
I believe we have had some Living Well too, yes.
Yeah, this is Julie from Fort Collins. We use Living Well.
Thanks, Julie. That's where I've seen it. Yeah, okay.
And
maybe Cheryl's on the call. I know, Cheryl, are there other ones that we've used that other license holders have used?
Gosh, let me get there really quick, and I can tell you real quick. Because, yeah, basically it's the Be Well or...
Be Well, Living Well, Healthier Living, Healthy Living, with Chronic Conditions. Or there's Healthy Living, Managing Your Ongoing Conditions, is what Kaiser was calling theirs.
Okay.
I'm still looking. I'm finding all of ours, and they're all Healthier Living Colorado. So let's see.
Well, we can send you the list, Connie.
Okay.
But that's the most of them.
Okay.
Yeah, Living Life Well with Chronic Conditions is another one I just found. But yeah, I'd be glad to go through and tell you what everybody's using and who's using them.
So that was just to try to see what all is in place and sort of illustrate the problem. I know when I first started working with this program myself, it was confusing. I went on the website and I was like, well, what are all these different classes? I thought there was just one chronic disease self-management program class. So, and I know actually we've gotten some feedback from other people in presentations that they've gone on the site and been confused about that as well. And, from a marketing perspective, in order to support everybody's work, it's really hard to do that without one name. On the flip side, I know that that's hard for people when it may be difficult for some, not everybody, but you're sort of committed to a name and somebody wants you to consider changing that. But it is really a challenge, and I think it will be an issue with our sustainability planning. And I personally would like to do more statewide marketing before we get that plan in order to, I've wanted to market the website, and I've wanted to do a brochure that could be used at our level and could be modified at a local level as well. And I'd also like to do a short video that could be used for marketing purposes that has testimonials which already exist, but also shows, maybe individual people's stories, illustrates, more about the program. But I'm hesitant to do that because, again, I don't know what to call it other than chronic disease self-management program, which, as I said, has that negative connotation. Of course, the other name is the Spanish language ones, Tomando Control, which translate to taking control of your health, of your diabetes. So I wondered what you all think about that and kind of where we go from here.
Connie, this is Monica. One thing that the hospital did is, because they have different programs that they're working with, and they've collaborated with different organizations and that type of thing. But on their website, and I know they're still actually working on it because they did this not too long ago, but they did pull everybody in, and we were one of them because of the classes that we offer. And they did do a video, and what we do is they pulled us in, and then we sat and we talked about what the program was, so it's out there. And then we were able to bring one or two people in to talk also, whether they were another leader or someone that had taken the class. Mm-hmm. And so I'm really anxious to see it, but I'm sure that if that was offered on the state website, I just think that would be really great too. So people actually know that there's people out there that are real.
Mm-hmm.
So I think
other
that would be a
states
really
have done
big
that,
plus.
and I'm sorry.
It was. Everybody was excited about it, and like I said, we're excited to see how it comes out. But I'm definitely for that, something like that, because I think it's, that would work really good. To get
And
out
there's
there.
so many great testimonials. Mary Pat has given some great ones in some of our training, and they're very compelling, even hearing it from a leader, but hearing it from someone who's been through the program, some of whom become leaders, would be helpful. And then there's ways to kind of show them in their life in the community as well. But so that's great to hear. And the obstacle, the first obstacle for me, though, is what do I call it? And so that's kind of what I wanted to start, raising that issue. I know Melissa from Boulder has mentioned that as a concern. Is Melissa joined the call by any chance? No, okay. So I wanted to see what people thought about addressing the name issue.
Well, I know COA went to the Healthier Living Colorado and Tomando Control Colorado, and that for us has been helpful. And I know when we do presentations on behalf of the collaborative, which I do quite a bit, we talk about the fact that it's known as many names in many communities across the state, and what it is it's all the same program, which is the Chronic Disease Self-Management Program, and then talk about that it's known by other names, which at least gets us a start in the right direction. I think that it will, those of us who have spent some time trying to get some name recognition, I'm a little hesitant to jump too quickly to changing it just because we've worked hard to get it where it is, even though it's not perfect. But I will say I'm definitely willing to have the conversation. I'm just not sure I I don't know exactly what we do with it.
Yeah, I know that there's that investment, and if you were the only one doing it, that would be no problem. It's just, you know.
Oh, I know. That's why I said I'm willing to have definitely willing to have the conversation, but it's hard knowing the time and investment we've made. It's much easier to switch from chronic disease self-management program to something else than it is if you've already switched to something else. Like, for example, University of Colorado has been doing Living Well, so it would be, I think, harder for them to switch from Living Well to something else. In the same way, it might be harder for us to switch.
What if we, well, could we possibly, because the name of the companion book that we use is Living a Healthy Life with Chronic Conditions, that's pretty black and white, but yet it's inviting. So could you just use, I don't know if you're able to do that since it's right off the book, but, you know, it's not really specific to anything. It covers all chronic conditions, and it's kind of, you know, everybody wants to live a healthy life.
Mm-hmm. And chronic conditions, to me, is less off-putting than chronic disease, and
right.
It also includes, you know, disability.
Right.
Yeah, see, and I think that's too long a title, but
yeah, that's what I was wondering.
It's longer.
Yeah.
Other thoughts?
Well, this is Eve. I'm not sure if you can hear me. Can you all hear me?
yes.
Okay. I really like the one in Spanish because it's got a positive connotation and it's short. And, you know, maybe just having the conversation will help things evolve because these things take time. But it is nice, I think, for healthcare professionals, we do get used to hearing all these different terms, and we're kind of desensitized, I think. We don't always think about the impact that it has on other people that are new to those terms. Mm-hmm. So I mean, I don't have any other suggestions. However, I think the one that's in Spanish is probably just super because it says taking control, and that still is pretty positive.
That's a good point, and it's active. You know, from a writer perspective, active verbs have more of an impact, and it does kind of get across what you all are doing. Not that the others don't, but it is very active of trying to get people to take control of their health.
Yeah.
Well, everyone, as I mentioned to you at the beginning of the call, I need to drop off because I have another conference call in just a couple of minutes. But what I'm going to do is keep the recording going, and I'm going to keep this line going because I don't want to throw off the recording. So I'm going to put this line on mute, and I'm going to drop off for now. But feel free to continue, and I will check back on this in a few minutes. And so I'm sorry to drop off before the end of the call, but that's what happens when you overbook yourself. So.
Well, Lindsay, I don't know if there is any other input. It was kind of quiet, and my goal was just to start the discussion. I appreciate what Monica and Eve and Lindsay mentioned. If anybody has additional comments or discussion at this point, we can keep it going. But if not, you know, we could just wrap up. Does anybody want to keep it going at this point?
This is Julie, and I have a meeting I have to get to, so I'm going to jump off.
Okay.
Yeah, same here.
Why don't we go? I mean, we're 3 minutes away from ending anyway, Lindsay, so I appreciate that opportunity to keep going. But why don't we just, if we could put this on the agenda again for next time, and we'll keep the conversation going.
Okay, great. Well, then I'm going to drop off, everybody, and I guess everyone else will too. So we will talk with you next month, and we'll have this up on the website very soon.
Thank you.
Hey, thanks, everybody.
Thank you.
Bye.
Bye.
Thank you. Bye.